Everybody, it's Dr. Brandon Manny. Welcome to the Functional Practice Podcast. This is episode number 18. And today we're talking about the top functional medicine conditions to specialize in.
Dr. Manny's passion for functional medicine runs deep. His passion for functional medicine marketing runs even deeper. Over the past several years, Dr. Manny has helped hundreds of doctors grow, scale, and monetize functional medicine in a big way. If you're ready to do just that, keep listening. If you want it faster, visit functionalmedicinemarketing.com. Here's Dr. Manny.
All right, guys. So a couple weeks ago, a doc asked, what should I specialize in? What should be the conditions that I should go after first? And he was kind of leading into is it weight loss? Is it thyroid? Is it diabetes? Is it neuropathy? What's the most, from a business perspective, what's the maybe the most popular, maybe the easiest condition to go after? And my answer to that is, what do you want to fill your office with? That's what you have to ask yourself. What can you see yourself helping people with on a day-to-day basis? Because for me, having an office full of fibro patients day in and day out would drive me insane. It would drive me nuts. Kind of the same idea with neuropathy. I to go into a clinic and see nothing but tingly feet all day would drive me nuts. And it's all Medicare, and it's going to be a slower history, a longer history. That would drive me nuts. But other people would prefer that. Maybe they prefer the slower pace. Whereas for me, I prefer a faster pace with ADHD kids, with thyroid, gut stuff where I can get in and out in 15, 20 minutes. It's not a 45-minute history from some dude who, has a history a mile long because he's 75 years old. See what I'm saying? So the question of what you should go after is dependent upon what you want to fill your office with. Okay, so that's the theme for today's podcast, is just kind of, think ahead. 6 months, a year, 2 years. What are you good at? What can you really help a lot of people with? What are the conditions that you want to really specialize in? I don't like to say go after or target. That sounds bad. What do you want to really specialize in? What do you want to be the best at in your town, your city, your area? What do you want to be known for? Okay, within your town, your city. Do you want to be the best thyroid doctor in your town? Is it the best diabetes? Do you want to start reversing diabetes and get people on a better plan of attack? Okay, for me, it's I've been in the arena of food testing forever. So if anybody types anything related to food testing, food sensitivity, food allergy, food intolerance testing, we've kind of positioned ourselves as kind of the go-to clinic for that, because we have 5, 6, 7 listings all over page 1 of Google for multiple cities, multiple towns, suburbs. We have videos popping all over, video testimonials and whatnot. So we've kind of dug deep into that specific condition. When people are searching for it, it's not really a condition, it's more of a treatment modality. But the reason why I like going after food testing is because that brings in a variety of people. That brings in gut dysfunction. That brings in sometimes headaches. It brings in people that want to lose weight because we're tackling their diet, and we're talking about inflammation. So, and it brings in chronic pain because that ties into the inflammation as well. So by marketing food testing, it can bring in a kind of a melting pot of conditions, so to speak. And so we've always kind of done that, and I've always been big into weight loss, thyroid, and ADHD kids. Those are kind of my biggies. That's what I see most of, with kind of a sprinkle of migraines, a sprinkle of some autoimmune stuff. Really comes as kind of a side effect too. A lot of people coming in for weight loss, they oh, by the way, I have Hashimoto's. Oh, by the way, I have celiac. Oh, by the way, I have this. And so autoimmune is kind of they just have it. They're not really seeking me out to fix their autoimmune conditions. More or less, okay, by the way, I have this, but I have gut dysfunction. I want that fixed. I have migraines. I want that fixed. My kid has ADHD. I want that fixed, right? So you really have to think, have to really visualize this, and don't chase money. That's one thing I think a lot of doctors make the mistake of, is okay, diabetes, these, neuropathy, these tingly feet are driving this patient nuts. I think it can gouge him for $6,000 a pop. Meanwhile, you've filled your office with a bunch of Medicare with probably maybe not your ideal patient is what I would say to that. And I know a lot of doctors that do a lot of neuropathy and they love it, and that's totally fine. But that's what I'm telling you is focus on what you want to fill your office with. Don't focus on what other people are doing, and don't focus on other people's business model and their collections and whatnot. Focus on what you want to fill your office with. That is where I would tell you to drill deep. Okay, so if you want to specialize in ADHD or thyroid or diabetes, that's perfectly fine. Drill deep in those conditions, but don't try and copy what other people are doing. Just because so-and-so doctor's doing $100,000 a month with neuropathy, that's that person's mission and vision and purpose. Might not be yours. Okay, can you see yourself going into an office every morning and seeing nothing but tingly feet all day? That's the question that you have to ask yourself. Okay, is that older demographic of 65 to 75 to 80, do you want to fill your office with that demographic? For me personally, I don't. That's just me. So when the docs ask the question, what should I go after? What are the best conditions? That's what I'm going to tell you. What do you see? What do you want to fill your office with? Yeah, that's the question you have to answer yourself. The money's going to follow. Money's a byproduct of just helping people. It's who you want to help. That's the question that you want to address, and you have to kind of think ahead a few years and then plan accordingly, and then focus your marketing around those efforts. So, all right, guys, I got to scoot. If you have any questions, reach out to me. As always, just make sure you subscribe to our YouTube channel and get in our closed Facebook group so we can keep in touch, and I can continue to add more information for you guys and more value. So have an awesome day, and see you next time.
Thanks for listening to the Functional Practice Podcast with Dr. Brandon Manny. Please make sure to subscribe and share with other doctors. Also, make sure to connect with Dr. Manny on Facebook and YouTube, or visit functionalmedicinemarketing.com.